topic that I'm doing is cancer and how it affected my life. So the attention getter of the speech is so that I can inform people and give tips on my point of view of what cancer was like from whenever both my parents had cancer. The thesis slash the central idea of the speech is that cancer is a horrible disease and it can be tough to lose a loved one due to having cancer. It can also be tough for the patient and for the loved ones. The reason I did the audience prevalence is because I want to inform, I want to give advice on people with having cancer. The reason I done this speech is because both my parents have had cancer and I want to give advice on what to say. So what's going to be on this speech? The first one is what causes cancer. The second is my story, my point of view of what both my parents have went through. The third one is the advice on what I like to say about people going through cancer. The first point is about what causes cancer. What causes cancer is cells. There's trillions of cells in the human body, and what happens is cells come together and they fight off one another, and they die and they reproduce, and that's what causes cancer. Some of the risk factors that includes are tobacco use, your dietary use, alcohol, you're overweight, you're obese, and how you eat. Some cancer-causing agents could be the same thing as you would use for the risk factors. So now I'm going to tell you my story, point of view of what was going through my parents through cancer. So I'm going to tell a story on how both my parents got cancer. How the surgery for my father was on October 20th in 2015, and we were all going up to the hospital. We were all packed up, and we got there. We got to the pre-op room. I held my dad's hand for a long time, and then how dad got cancer was there's two causes. One could be from tobacco use, and the other could be from chemical use where he worked at in the water plant, and the cancer was laryngeal cancer. Now, how I got used to my dad's voice was I was getting used to my dad's voice. Even though his voice wasn't there anymore, I still got used to it. Now we're going to move on to how my mom got cancer. Mom's surgery was on late October in 2017, and it was at the same hospital my dad's surgery was at. My mom had a double bilateral mastectomy, and then after that she got reconstruction surgery from her belly up to her breast. And I mostly just sat there waiting patiently until mom and dad got out of surgery. And then the night before mom's surgery we went to a hotel and stayed there for and at like 4 o'clock in the morning, and then we went out at 6 or 7 in the morning, and then the transition was I would like to give advice on how to deal and how to cope with cancer. So my third main point is advice on how to cope with cancer, how to tell children that your parents or grandparents have cancer. You need to be honest with them and tell them that they've got cancer. You need some source confirms that makes them informed and include. Okay, wait. And then now I gotta include a visual aid, which is the age-specific risk of breast cancer in the United States. Men don't have as much of a risk as women do with breast cancer. So the highest risk would be between the ages of in their mid-60s to 70s is the risk for breast cancer for women. Men is typically around their mid-70s, mid-80s with breast cancer. And now to conclude my speech about the advice with cancer. The first main point was the root cause of cancer. The second main point was my story on the surgeries between both my parents having cancer. The third point is advice on how to deal with family members with cancer. And then I have to restate the central idea. Cancer for family is a tough disease. For both the patient going through the cancer and the family with the people who are in the family with cancer. And my closing is cancer is a tough disease. It's tough for both the patients and the family members. I've gone through this with both my parents being treated, and they're both here today, and I'm really thankful about that. And that is all from my speech.
Good job.
Don't tell me.
Okay.